So, in the name of the Department of and the Unit of Management of Health Threats in PAHO, we'd like to cordially welcome you to this webinar that is called Intersectoral Recommendations for Surveillance of Wildlife, Domestic Animals, and Humans. This space is part of the series of webinars about the human-animal interface, and the goal is to strengthen cooperation between public health, animal health, environment, all of this under a One Health approach. I would like to let you know that we have simultaneous interpretation in Spanish, English, and Portuguese. To access this, please use the interpretation icon in the Zoom toolbar. Choose the language that you prefer, please. And to give you some context, we have to remember that CIPCIZA was established to improve preparation and response to zoonotic threats, especially avian influenza that is highly pathogenic H5N1. So in October of 2024, there was a meeting with experts in Washington forming technical surveillance groups, risk assessment, and lab groups. And today we will show you the main recommendations of the regional report that was created by these groups. We will promote the technical exchange amongst countries. We thank you for your participation and we invite you to interact in the Q&A session. You can use the Q&A to jot down your questions. Now I will introduce Dr. Daniel Magallanes, veterinarian doctor and specialist in panaftosa in PAHO, and he will be sharing with us his presentation called Recommendations of CIPCIZA for Intersectoral Work. Daniel, you have the floor. Do you hear me? Okay. I'm gonna load the presentation. Yes. Can you see it? Perfectly. Very well. So I'm going to pass to Portuguese because I think it's a little more natural.
Now I'm going to Portuguese, okay? Good morning to all of you. It's an honor to be here to present this work that we did in PAHO with the follow-up of the epidemiological situation, avian situation in the region since its beginning. Thank you to all the participants and the colleagues. Well, I'm going to start this presentation. This is a general overview of our situation. First of all, I would like also to show how the disease was established in our region along the recent years. And then we are going to have a situation analysis on the main challenges we face in this coordination among the stakeholders to face the diseases of the challenges of this disease. And then I'm going to the background, the structure of the commission, the groups that were established, and if the activities they implemented, how the activities were implemented, and the recommendations resulting from these groups. Well, first of all, we are going to see the history of the disease, how it was established. We have this distribution in our region with a history. It arrived with strength in 1991, but it had already been established in the world. It was detected first in Guangdong, China. And since then, this virus was being adapted to different populations and different scenarios along these years. The year 2000, it was disseminated in the European region through these migration routes, these wild fauna routes. And since 2005, 2006, it was very well established in Europe and in this Central Asia area. And from 2014 to 2020, we see this outbreak that we see in our region. An important change that we can say in 2020 and 2021 was the clade that acquired the capacity to remain the whole year. As you know, influenza has oscillations of incidence along the year, a seasonal incidence, but this clade was able to settle among the populations, the wild populations along the year, with wild populations showing a potential change in the epidemiological characteristic of the disease. In 2021, through the migration routes, this virus arrives to our region, to the Americas, first to North America, then expanding to Canada, to the United States. And in October 2022, we have the first detection. Once the virus was established in North America, it started the migration to South America. And in 2022, we have the first detection in Colombia with a very fast spread in South America. When we see the context in South America, we find this scenario. We find a rapid increase in North America with an expansion to Central and South America. In the region, we have a very important bird production. The 10 top bird production are located in this region: United States, Mexico, Brazil, Colombia. Again, this is very important from the animal standpoint, but also for the adaptation of the virus. This is a very important data to understand the context. As I said before, since 1996, we have information on this virus and how it is circulating in the world. And we were also acquiring knowledge and understanding of the genetic characteristics, how it relates to the different populations. But here in our region specifically, it was something new, and we didn't know the epidemiology of the virus. We didn't know how it was being established in our region. Here, in the Americas, we have an heterogeneity that is very important in general in terms of income and productive systems, the response capacity, the detection capacity, and this heterogeneity presents a very important information to understand how the virus was established in our region. We also have different bird species, wild animal species, wild mammals, and finally, a very important presence of subsistence production that is very important in many areas of our region for food security. Here, we also find a representation in 2023 of wild animal cases and domestic animal cases, cases that were already disseminated in North America in South America, in the north of a country, in the south of a country. And here in these red points, these red dots, we see the countries with human cases. We had a case in the United States, in Mexico, Canada, Ecuador, and Chile. Every human case, every country had a case, a specific case. We had cases related to human cases, animal cases, bird cases, dairy production case, subsistence case. Again, this is a very important challenge to be able to understand and get organized around this challenge.
Still in this context overview, I'd just like to show you an overview of cases in wild animals. One of the important changes this virus presents is that before, these highly pathogenical viruses were not particularly lethal for wildlife. However, this clade specific has a very high mortality rate. As we can see, the cases of pelicans off the coast of Peru and Chile, an extremely high death rate, and it's an important challenge for the authorities in how to handle this high mortality rate. And also in wild mammals. We've seen this especially in Chile. Sea wolves were highly impacted, and we started to see genetic mutations, genetic changes that may point to a certain degree of adaptation on the part of wild mammals. Now, still on the development of these viruses and the important issues we need to bear in mind, I want to say that the clade we're dealing with today, 2.3.4.4b, has been detected in Europe before, where a few genetic alterations have led to cases in different mammals. At a certain point in time, the virus is introduced to North America and it starts to blend with other strains of low pathogenic impact viruses from the region. And then we see the spread of it to other animals, including domestic mammals, once again lighting the red light of regarding its spreads. And just to wrap up this historical series, this is the number of cases in 2025, where we can clearly see that the scenery of a very high dispersion of cases in North America from 2022 and 23, the point in which it entered South America, 2022 and especially 2023. And you can also see a decrease in cases from 24 to 2025. So this is the overall context that we've been working with in the last years. In March 2023, when at the very height of the most difficult part of dealing with a virus, we had a meeting here in Rio de Janeiro run by the PAHO, which brought together specialists from several countries in the region, specialists in public health, animal health, and others to come together and discuss our response to the spread of this virus, understand the challenges that the countries were facing at that point in time, and also trying to strengthen the work we should do on the interface between humans and animal. And that was when we divulged the guidelines designed by the institution for handling these cases for wild animals, for domesticated and farm animals. So to support the country to detect at the earliest stages possible the arrival of this virus and its mutations. Now, this document gives us a situational diagnosis of what is going on in the region and what should be done about it. Firstly, articulation between actors in a region happen at moments in which a crisis is installed. They're normally ad hoc when an emergency is come upon us. So this is always done on the spur of the moment during the crises, but we should, in fact, consider the mechanisms that we should put into practice beforehand. Another important thing that we found out was that vigilance, epidemiological vigilance, really has its blind spots. It routinely has low levels of detection in populations that, for example, do subsistence farming. For example, birds who are bred for subsistence purposes are not covered either, typically by veterinary services that are typically centered on industrial level animal farming. Neither are they under the wing of domestic animal care. So these animals are in a gray zone. Another issue that we found was that there was a low level of integration between labs and their bioinformatic analysis capacity was also low. Another interesting document that was issued when we were running an analysis of the context, and it's also a historic record of their findings, was edited by FAO, and they assessed the answers of Caribbean and Latin American countries during the outbreak that we experienced. So, in terms of situational diagnosis, what we find here is that the diagnoses are isolated, so there is no instance of coordination, there is no understanding of a basic set of response practices that should be adopted by all. The practices these countries had adopted in dealing with wildlife deaths was also inconsistent. What is the protocol that should be adopted? How should these animal remains be disposed of? Should they be buried? What should be done? So these are always considered a weak point in our capacity as a country to provide responses. Another important issue is the political economy. These costs are not well recognized in terms of intersectoral relationship. Who bears the costs of, for example, the disposal of wildlife remains? Also, domestic animals. Normally, these lines of costing are not well designed. Taken as a whole, this really is a burden on preparing for a new outbreak. We know this virus is not liable to go away from our region, so it is important to have a very clearly designed response mechanism in place. Now, after the discussions on how to deal with the issue, The implementation of the commission happened in 2024. The discussions at first were centered on avian influenza. Even the name of the commission reflected this focus. But within our discussions, there was an understanding that these highly pathogenic strains of avian influenza were not the whole problems. We have also other animal populations, such as swine and cattle, and all of them must be considered when we think of the risks that we face. So the commission changed its original name to term it as a zoonotic influenza control effort and focused mainly on the highly pathogenic strain of influenza. Besides their regular administrative work, there are the ad hoc work groups that deal with specific issues in this problem. And we invite specialists from several countries in these varied areas and sector. So groups who focused on epidemiological surveillance and risk analysis, lab genomic surveillance, intersectoral coordination, preparation and response. Last October, the working groups had their first meeting in Washington, mainly the first two groups. And we drafted a document which is available on the PayHome website. I think the next presentation has a link with a QR code so you can handily download it. And this document lists the main recommendations that we have for all different sectors to ensure that all different sectors work in tandem and articulately. So not only the context is not closed in on itself, but also permeable to other sectors. My part, especially regarding animal health and wildlife population, and then Priscilla will take it up later on and delve deeper into public health aspects. Now, when we speak about wildlife recommendations, as I said before, wildlife is normally one of the blind spots in surveillance. In the three main areas, normally they are the area with the smallest infrastructure, the smallest budget to provide a response. However, it is probably the sector who will first come into contact with the virus, because normally the wildlife is the first to manifest the virus. So this is an important gap, and we really need to focus here to increase our ability to detect viruses in these wildlife populations. So there are several key issues that should be considered in working together. Firstly, determine the competencies that people who work with wildlife need to have. In different countries, different institutions deal with this issue. Some countries have institutions that focus on surveillance of wildlife. Other countries, this is in the hands of the official veterinary country services. And so we really need to understand who is responsible for doing the surveillance, collecting the samples, processing the samples, and this can be done in articulation with several other areas to understand, for example, who the The collected samples are processed through the main veterinary health services from the countries. Determining this chain is absolutely key.
We need to understand the specificities of the disease. That's essential. But at the same time, we need to have a contribution on the part of health sector to say what are the suspected cases. And from then we can establish clearly who is going to monitor, especially in terms of the follow-up of migration routes, the indication of suspected cases. Another important part is the implementation of technological tools to support the surveillance in these populations. We are going to be able not only to assess the routes of wild animals, but also we are going to be able to cross this information with other subpopulations that are relevant, for instance, in terms of subsistence, commercial production, to understand the linkage among these populations. And finally, here for wild fauna, we need to promote the PPP and academic partnerships. The academia has an important work in terms of monitoring the viruses in these wild populations, but also concerns in terms of publications, concerns in terms of data, general data. With this PPP, with this collaboration with the private and public sector and the academia, we can see what are going to be the benefits in this process. Well, for bird animals, for birds, the first recommendation is to have the mapping of the risk of subsistence animals through the mapping, together with the information that we are going to collect on birds. We are going to have a clear structure on the places, a clear information on the risk areas in this interface between the domestic animals and the wild animals. Also, by using this mapping, we are going to be able to implement awareness raising campaigns for farmers. And these farmers, this human population is going to be our baseline, our first line for identification of the disease. And from then, we are going to be able to focus our surveillance actions in risk areas and also with a certainty of covering the territory in the best possible way. Another important aspect for the recommendations is to include within the surveillance, the veterinary surveillance information, the aspects that are relevant for public health, to pay attention not only to the cases in domestic birds, but also through the coordination with the other services, we are going to be able to understand the situation surrounding the cases, to understand what are the other populations that are under risk, human populations and other wild populations that are under risk. And the veterinaries, they have this capacity to understand this information and generate information triggers for the other stakeholders and the other entities. Another thing related to domestic birds, and this is a very important concept, is the surveillance of other avian influenza subtypes, for instance, the H9N2. This virus, this low pathogenicity virus, is mainly seen in hens. And other viruses of low pathogenicity can also be harmful for human. populations. We need to have a surveillance and monitoring of these other viruses, and this is very relevant to have a better understanding of the epidemiology in the region. Today, these subtypes are not of mandatory notification among the authorities. They are rarely notified, but we are advocating for its notification as something important in the future. Again, talking about domestic animals, domestic mammals, we have two populations that are important for the region, the pigs, and we have a blind point here in terms of the surveillance in the region. They are prevalent in the region, but we don't understand the size, the magnitude. We don't have a proper follow-up of this population and the modifications in these pig populations. And for this, we understand that we need to have this joint assessment to detect the most concerning variables in the pigs to have these studies. And with this, we are going to be able to establish surveillance protocols, and also the other way around. Once we detect the variants in humans and pigs, we are going to be able to do the surveillance. For the cattle, we don't have cases of cattle in Latin America, but we need to understand that, and we need to have that once we have a suspected case for the countries that were not doing the coordination, they should coordinate with other services to define the suspected case. This in cattle, we usually have an STPI and specified signs. But it is important to understand very well these suspected cases. Once we have these suspected cases in high-risk areas, we need to sample the dairy production. We need to have a detection, a collective detection of this virus distribution, this virus circulation. But we also need to understand that we need to do this in the highest risk areas in this population. Here I'm going to review very quickly the recommendations on public health. We still need to understand, we need to establish these notification protocols. Once we have a human case, we are going to be able to know how the notification chain is in case of a positive case. We need to understand the occupational risk, the human populations that are more connected with this animal interface, and also we need to work on the vaccination for this group. And we also understand that the community surveillance is relevant, especially in the countries that lack or that do not have a agricultural production. The community surveillance is one of the main elements for the timely detection of the entrance of the viruses. And in this regard, the authorities are our main partners to take this information to local communities in terms of health. And finally, we also have recommendations in terms of laboratory. It is essential to have this exchange of protocols on diagnosis, we need to have a standardization. We need to have a standardization of the tests. And once we have the study well established, we need to also establish methods to guarantee that all laboratories have the capacity for detection and for the testing. And together with this laboratory capacity, we need to define what samples we are going to take to the final diagnosis with the medical cascade to have this type of governmental tool. And finally, for laboratories, they need to clearly understand the multilateral agreements for the exchange of material, respecting the copyrights of the material among the laboratories. Well, this is the general overview in terms of recommendations. Now, Priscilla is going to tell you more information about the part of public health and laboratories. Thank you very much. I am now here to answer your questions. Thank you, Daniel.
You're invited to write your questions and comments in the Q&A Zoom box, and then I'm going to present human health recommendations. Please let me know if you can see the screen. Yes, we can. So this is the second report dealing with recommendations with surveillance among humans, human surveillance. This shows the QR code you can access on your mobile phones, but that's going to be published also in the chat box so that you can access these resources from your laptops. And Daniel has shared with us an outstanding presentation of the report in regards of animal health. I'm going to go directly to the surveillance of human populations that are exposed because of their low labor, their occupation, and I'm going to identify the risk groups. We have workers in dairy and pig farms that are the largest groups exposed to labor risk, occupational risk, and it's important to have a specific strategies, surveillance strategies for these groups, and also to include these groups as a target populations for vaccination and prophylaxis against the viruses, and not only that, but also for detection and control. Also, the cooperation across the sectors is critical among the official government veterinary and public health teams to assure detection and monitoring both in the animal and human populations that were exposed to the those animal populations. So the key is that early and timely detection of a zoonotic influence among humans is a key to prevent sustained transmission. And to this effort, it is critical to have a cross-sector response and a strengthening surveillance at various levels. So one of the recommendations focuses on strengthening human surveillance after animal cases have been identified. It is critical that zoonotic influenza among humans after their zoonotic detection should be put in practice, and also to engage in unusual respiratory events that should be surveilled. And if this approach is not in place, the recommendation is to do so and to strengthen surveillance in response to outbursts among animal outbursts. Once the most exposed populations are that are in closer contact with these animal populations. The second issue is to coordinate cross-sectoral response in cases of zoonotic influenza, human cases. And when we have public health integration with official veterinary services, it becomes possible, not necessarily to guarantee, but to have a greater certainty that there will be a more timely, earlier response. And it is important to develop protocols for research in human cases and their connection to animal populations. This is also important because once we have this information of the connection with the animal populations, investigation can be carried out. It'll be at an earlier stage, and it is to monitor epidemiological evolution and potential transmission. If there are any other cases, both among the animal population as well as we do not yet have a human-to-human transmission, but this is, however, something that we should bear in mind. Once the virus, because the virus mutates kind of unexpectedly, and it's important that we also engage in this kind of a monitoring to ensure, to verify human-to-human transmission as well. The third item is to involve the community in zoonotic surveillance. For instance, to integrate community surveillance in early detection, both for humans and animals, and to train the population on symptoms and reporting mechanisms, and surveillance, community surveillance, and to collect this information to provide the means and so that earlier surveillance can be done by the communities. Once the community understands the symptoms, is aware of the potential symptoms, that will be essential to provide an appropriate response. This is an example of intersectoral surveillance in Paraguay, where the animal health service or sectors has been provided with a guidance for early detection of cases where this interface is present, and through surveillance of the exposed populations. This protocol holds that if there's an appearance of aviar influence among animal populations, they should get on a strict monitoring of exposed populations for early detection of suspect cases among humans, but also to engage or carry out communication activities, risk communication activities with the community. Now I'm going to address the laboratory surveillance. I'll be talking on behalf of the laboratory response team. The key recommendations for laboratory diagnosis of avian and zoonotic influenza are numerous, but I feel that they all aim at strengthening the diagnostic capacities concerning avian influenza and zoonotic influenza by promoting intersectoral cooperation that we're all looking for, and the integration of new protocols and technologies among the various involved sectors or agencies. In this regard, it is important to strengthen the laboratories, animal health and human health laboratories capacities. This will, in turn, as Daniel just mentioned, will significantly assure that we are all on the same page, that we all speak the same language by exchanging, sharing our protocols. To share these protocols that are currently used for both human and animal health. This is critical. And to this end, it is important that everybody will be on the same page. Also, it is important to set forth regional guidelines for laboratory diagnosis among animal populations, as well as in wild fauna and pig populations, with a clear definition of flows, protocols, and diagnostic criteria. Excuse me, please. Apologies. And let me continue. These populations that are not, so to speak, as involved in surveillance, it is critical to involve them to get information from them. And to that end, it's important to have these guidelines. And it is also important to strengthen cooperation among reference laboratories and national laboratories to foster technical training. Oftentimes, and not only within each country, where there may be reference laboratories and national laboratories, in the country or the state laboratories or the district laboratories, but also among animal health laboratories and human health laboratories. Cooperation and among these two types of laboratories is important. This is a slide showing the Mexican case where there's been a integrated system implementation of laboratories for zoonotic influenza detection, and they include standardized protocols that have been implemented, and they have strengthened the response capacity once suspect cases are identified. This integration among laboratories improves epidemiological surveillance and response to zoonotic influenza. Another issue that Daniel mentioned has to do also with fostering logistics and access to critical inputs. We are aware that this is critical in our region because oftentimes when an emergency comes, the purchase of reagents and inputs becomes a very difficult issue. And so there's got to be regional and national strategies to procure these inputs and materials to assure greater efficiency in these processes. It is also critical to foster intersectoral cooperation, as was mentioned, among apologies for the interruption. It is critical to raise awareness among countries among the importance of cooperation and collaboration among sectors, across sectors, internally also, but among countries, so that high priority sample analysis can be conducted jointly so that we are aware what's happening not only at the national level but also in other sectors, but also across the region. And this articulation among human health and animal health laboratories is possible in this way. And also, it is important to have a one health approach in animal health laboratories because this sensitization is also important for the animal health sector. It's important so that they understand the importance of their contribution to global influenza surveillance. And not only is it a matter of sharing epidemiological information, but also as reference material for human influence and pandemic viruses. And this is a critical issue. So we identify a virus that are circulating around the region and that may be representative of potential pandemic viruses vaccination. In this respect, it is important that there should be strategies in place for sample sharing among countries, but also among sectors. As Danielle just mentioned, always with a proper respect for intellectual property of these samples, but it is critical that the response to early appearance of cases is possible, and also for sharing samples with, for instance, our Influenza Collaborative Center, the PAHO, that's St. Jude Children's Research Hospital, and also to create material transfer agreements that are clear and address both the benefits of and access of a participation in this exchange, always with true respect for intellectual property. This is a slide showing the example of Ecuador, where the Human Health Laboratory helped the Animal Health Laboratory in exchanging samples and their analysis. And this made it possible to improve monitoring of human health and joint decision making, and thereby strengthening surveillance in the interface and also strengthening response strategies for a future outbursts. And it's also there are also other examples more recent examples in our region where the public health laboratory engaged in animal sample sequencing, and this is a extremely important issue to gain a better understanding of what's happening with viruses, and also to engage in this kind of a monitoring to be able to provide responses to these cases. And when it comes to sequencing, genomic sequencing is very important for early detection. For instance, if there are mutations that have to do with the adaptation of the virus to a mammal population, for instance, or for human to human transmission, strengthening this cooperation, collaboration in genomic sequencing permits to assure standardized and quick surveillance and among human laboratories. This is particularly important for early detection as well as using sequencing as a part of routine procedures. Oftentimes, the animal sector is more focused on virus sequencing, but when it comes to public health, sequencing is also very important to better understand or to gain awareness that of the fact that these markers of a higher transmissibility among mammals or potential mutations for human to human transmission, and also for susceptibility markers to antivirals, and also to encourage participation of animal laboratories in the PAHO-GEN, that's the Pathogenomic Surveillance Network, in an effort to foster intersectoral cooperation. And this is the slide showing the example of Chile that also has in place a significant integration between the animal and cattle services and the public health services to allow effective influenza surveillance that combines the various capacities for diagnostic but also for sequencing. It is important to strengthen the capacity to engage in genomic surveillance for virus monitoring, both by identifying viruses that are relevant for public health, but also for those that are relevant for animal health, and to invest in bioinformatic analysis capacities in animal health and human health laboratories to improve genomic data interpretation. What often happens is that we do sequencing and even more sequencing, but we are not able to analyze the data and verify what is actually happening in regards of evolution, whether there are virulence or transmission markers, or as was said, mammals adaptation or resistance. All this ideally should be carried out on a daily basis, on a routine basis, to for the early detection whether there's any of these markers that are present and that would require further attention. And to conclude, I would like to share with you, excuse me, share with you uh, um, this takeaway that shows that effective surveillance and preparation for emerging threats depends on intersectoral coordination. Everybody should be on the same page, and it's also important to strengthen laboratories. Only through early detection and collaboration will be able to respond in a timely manner and protect public and animal health. These are some links that you can access to get additional information, and the link to the report itself, but also about more detailed researches from CIPCIZA and our reports include an interactive dashboard to monitor AH5N1 avian influenza in the Americans, information about influenzas, SARS-CoV-2, VRS, and other respiratory viruses in the Americas, and the more general information about what's going on in our region. This is where I'm going to stop, and I would like to ask Milena her help because of my health issue. Very well, thank you. We have 6 questions so far.
So I'm going to go through the questions and let's see if Danielle, you can help me, or maybe we will answer them with Priscilla. Thank you very much to both for your presentations. I think you have shown us good scenarios and advances, and we'll begin with this question. Alberto Colorado from Mexico asks, do you include some collaborative work with Mycobacterium bovis, especially in cattle? Thank you for your question. No. Right now, these activities are mainly related to influenza. But we understand that this is the moment to create connections among sectors. So we believe that in a future, these governance and connection mechanisms amongst different stakeholders could bring benefits to other illnesses. Tuberculosis, brucellosis, and others. So we think this is a moment to learn about these connections that we can create. Thank you very much, Danielle. The next question comes from Julio Cordon from Guatemala. He asks, which is the reference lab that used for America? Hello, doctor. How are you? It's a pleasure. For animal health, we have a reference lab in Campinas. This is animal health, and they diagnose avian influenza. We work with Dr. Dilmara there. I understand that you are asking about animal health. Thank you very much. Yes, sir. Just to add, says Priscilla, Milena. For human health, we have the national influenza centers in each one of the countries. Those that do not have a national influenza center have the national reference lab, and the samples have to be routed within the GIS for the collaborator centers that we have for animal samples and for human samples. We have in Atlanta and in London, and we send and we support with that envoy. Thank you. Marta from Paraguay asks, what are the recommendations for bird vaccination? Thank you very much for the question. Well, this is something a little more complicated, but we see that there are criteria. There are different types of bird vaccinations. There is a preventive version. There is another possibility when we have circulation. So we have different contexts. The recommendations is to respect the context. So the country should understand why they're starting to vaccinate. And if there are strategies to exit that vaccination. So for this, you have to do an assessment that is very broad. You assess the benefits. So you have to understand the risk. You have to adapt your strategies to those risks that are being assessed. You have to have clear mechanisms for this vaccination process, and the follow-up that we should have with surveillance of these populations, because once we start to do bird vaccination, we will be lowering the detection capacity through passive surveillance, because the vaccine mainly reduces symptoms. So, well, if we don't have the sensibility in passive surveillance, we have to enact specific surveillance for the population. So we have to consider the risks. We have to adapt the strategies to those risks. We have to have elements to also exit that vaccination strategy and follow up on that specific population of vaccinated animals. Thank you very much. Here we will continue with Diana Vidal from Mexico. She says, considering that in some communities animals are bought illegally and there are cultural practices that require direct contact with animals or their waste products, what strategies would you recommend to address these populational groups from the animal and human perspectives to reduce the exposure to zoonotic influenza, as well as to strengthen surveillance mechanisms and early detection and intersectoral coordination under the One Health approach? Thank you for that question. It's a great topic, because there we see the importance of this One Health approach. So this is a population that, like backyard fowl, they fall under this gray area where it's animal health, but it's also not necessarily commercial. So we see that this is the moment to have health agents, community surveillance agents play a very important role in raising awareness and in having communication for these populations. So the strategy is to interact through intersectoral risk analysis to identify those populations and to define the communications messages that we would bring to the people, and through different stakeholders, and that will depend on the country. Each country will define which is the stakeholder or actor that is able to reach the population, and through the different stakeholders we reach these communications to strengthen mainly passive surveillance. So So bring the message that there is a risk and that people have to be able to identify symptoms and to be able to notify in a timely fashion. Yes, and says Priscilla, I also think that we have to have effective risk communications for them. If possible, also to have vaccination for some populations that are at greater risk for seasonal influenza. This is something that can support these groups that are at greater risk. Thank you. Thank you. Thank you for that answer. So now we go with Dr. Alberto Colorado asks, the efforts that you have made to address the pandemic virus is commendable. So would it be worth to use your methodology for the expansion of zoonotic illnesses of interest to human health, like bovine tuberculosis in domestic animals? In the Coalition for TB in the Americas, we will be paying attention to your collaborative work. So this is an opportunity to create collaboration. The next question comes from Suriname.
Y nos dice, can samples suspect of containing animal aged by processed in a public health human laboratory?
Esta es para
I
mí.
think that question would be for me.
No, we don't recommend the process the samples in human laboratory. However, there is some points that should be could support the country. For example, if you have a laboratory specific for manipulation of the sample, you can use this and send the RNA to the human health laboratory. And in this case, you can process the product extracted from the sample. It's very important to keep this in mind once you have very important biosafety and biosecurity instructions from the National Influenza Centers and national reference laboratories from health, human health. So that is possible to do in this way and not process the sample directly in the human health laboratory.
Thank you very much. Can I add a comment to that? Yes, of course. Again, this connection is the fundamental moment to understand the minimal capabilities of each one of the labs. So, from animal health, what are the minimal needs that we should have to achieve a good diagnosis, for example, a serology diagnosis, and then just pass the genetic material in the conditions that Priscilla mentioned for sequencing or for something more detailed in public health. That's something that can be managed. But again, there we have the need to standardize protocols and harmonize the chain so that we have clarity on the competences of each one and how each one can collaborate. So what I would recommend in that sense is, well, that we have that minimal capacity to reach a diagnosis through serology is okay, and this is to understand the risk, and then we can pass on to a greater detailing in public health labs. But again, here is where we see the importance of this shared understanding by the whole chain. Perfect. Thank you very much. Regarding the links, we already have them in the chat. We have the report mentioned by Priscilla, and we will also share the recommendations later on. We have one last question from Guatemala, from Mar Ordóñez, Maria del Mar Ordóñez, and she says, any recommendations on surveillance on markets that have live birds? Thank you, Mar, for the questions. There aren't any specific recommendations, but we see that we have the same structure that we mentioned before related to the special populations that are not falling under any specific service. So we have to map the risk. I think that would be the first step and the most relevant step of all of this, with a good mapping of where these markets are and its connections to backyard fowl populations or wildlife and the possible viral circulation. So I think it all starts by mapping the risks given the context of the region. Lucero raised her hand, so let me give her access so that she can say what she wanted to say. So you have access to audio, Lucero. Yes, I was about the same thing of market of live birds. Your your mic is open. Did you want to ask a question? No. Okay. So we have no further questions in the chat. So we'll finish with the Q&A session. Priscilla, let me give you the mic. Thank you, Milena, for your support. If you have any additional questions or if you would like more information, I just typed the emails in the chat box. I'd like to thank all of you for your participation. I'd especially like to thank Panatosa, represented by Danielle, and I'd also like to thank the interpretation team, and I'd like to thank each one of you for your contributions. I hope everyone has an excellent day, and we hope to see you in the next webinar. Bye.